Now here is a quick effort to remember the hepatitis B virus infection serology. So how can we remember that? See, what we will do is that in acute phase we have HBsAg and HBeAg positive, and in chronic HBV infection high infectivity also HBsAg HBeAg is positive, and HBsA anti-HBc IgM is there, and here anti-HBc is IgG is there. So acute HBV and chronic HBV will have similar serology, but the difference would be only that here IgM would be present, here IgG would be present. Now we come on to the window phase. Now remember that in window phase only you see through the window. You see through the window the outside world. So here when you see, so here it would be C. So only IgM anti-HBc is positive for window phase. And similarly, when we are in HBV infection in the remote past, remote is used to see the TV. So only IgG is positive in HBV infection the remote past. So here window plus remote past used to see. So therefore anti-HBc would be positive in these. Fine. And then we move on to the recovery window phase. Now window phase and remote are done here. Only one parameter is positive. Now we come on to the recovery phase. Now recovery phase will what happen that we have auntie. So you remember that in when we are in early phase, the no auntie will be there to look after, only mother will look after us. But when we are in the recovery phase, then all the auntie will come. So anti-HBs and anti-HB is positive in case of acute HBV recovery phase. Now chronic HBV high infectivity we have already done. Chronic HBV low infectivity, what you have to remember that HBeAg is for replication. So when we have anti-HBe, so there would be no replication or low infectivity. So chronic HBV low infectivity. Now HBV infection in the recent past, we will have anti-HBs. So you have to separately remember that in the recent past will have anti-HBs and IgG. But in the remote past, your remote is used for TV. So here you can see anti-HBc only. IgG anti-HBc would be positive. Whereas post-vaccination can also be written as PV or per vaginum. Now per vaginum is examination is done in obs and gynae for she. Now she, from that we can derive S, so it will become anti-HBs.